I have interacted with doctors who actually manage SARS patient, and they were actually very emotionally affected. And as a result, I carry out the research, and this is a way to reflect on what happened during the SARS outbreak and how we can learn from the whole episode of the disease. So what we found during the study was that there was inadequate supply of this PPE, and doctors felt very vulnerable. We learned from this study such that subsequent to the outbreak, we have inventory of all the essential protective equipment. We regularly carry out audit to ensure that the stocks are available, to ensure that our staff are properly trained to put on all this equipment. We also published a case report of a patient who actually presented with 2 episodes of fever within 5 days. There are lessons to be learned from this case report as well. This is very important to stress to patients to consult the same doctor to ensure that there is continuity of care, such that the doctor is able to recognize the disease pattern better, and as such will be able to come to a more accurate diagnosis.
In SingHealth Polyclinics, we have the infectious diseases work group, and one of the major tasks of the work group would be to help craft guidelines with regards to infection control and infectious diseases. And these guidelines will include the use of personal protective equipment, pandemic preparedness, what to do in the event of a pandemic. The work group does surveillance. We observe the trends of infectious diseases locally as well as globally, so as to look out for outbreaks. As part of our pandemic preparedness plan, we conduct drills to simulate the onslaught of a pandemic. So everybody will go into action, so to say. We will activate our triage. We will have a mock patient who's got fever and with the clinical features that would resemble, for example, a SARS, something similar to SARS, and how we then manage. So we would then test out how robust our system is. I think the most important lesson and the most important bit of advice that I would give to polyclinic staff and even to myself would be to not forget the basics. And simple measures such as hand washing, cough etiquette, and being vigilant to possibilities of a pandemic occurring. These are the measures that are important, and these are the ones that help us prepare for the unknown.